What's up, everybody? So this is part 5 of the series of my scapholunate ligament reconstruction. So we are officially 2 weeks post-op as of yesterday. And hey, phase 2 began. I got the cast on. So they took the stitches out, put the cast back on. So I don't know if you call it in one of the other videos. I don't remember which one. I said that, I knew about the incisions that they were going to do to take out the tendon that they were going to use as part of the reconstruction, but then there was something up here that there was. And so yesterday, once they kind of took the splint off, took everything, cleaned it off really, really well. So it's kind of like right here, this side. So it's kind of like right here, right kind of underneath my thumb on this back side here, kind of goes like this a little bit. So apparently it's to help to alleviate some of the pain that is inevitable with with the swelling that is also inevitable. And it's a procedure that they use during carpal tunnel procedures. So I don't recall exactly what the name of it was, but I had asked about that, and that's what I was told, that's something that that they just kind of do as part of the procedure to help just kind of alleviate some of the pain and discomfort from the swelling that's going to come. But it is another big scar right there. So like I said, here's probably about an inch long. It's probably about an inch long, maybe a little bit longer, but probably about an inch here, kind of right here. So, but all in all, really nice with the, as far as the healing. My hand is still pretty swollen, but it is less than it was. And the doctor, I was told that, that the swelling could persist for another month, or to not be surprised if it still just kind of takes that long. So, it kind of is what it is. It does with the cast on. So I've never had a cast on before, but the cast is very, very restrictive. Like with the splint and the soft wrap, you still feel like if you really put some force into it, you could move. You can move your wrist in some direction. With this is not going anywhere. I don't know, for those who've never had a cast on before, once it gets wet and starts to harden, it also it shrinks in. So it's literally almost like it's vacuum sealed around my wrist. But then on top of that, it's all hard. So it's very protected. It feels stronger, but it's not. So you have to be very, very careful. That once I got this on yesterday, it was yesterday morning that I got it on. I was kind of thrown off a little bit by how secure it felt, and therefore how strong it kind of felt, that I started doing some things still very carefully, very gingerly, but I felt the pain and the weakness kind of almost immediately. So, just you start to be careful. Like, it's a step in the right direction. The cast is on and the stitches are out, kind of really well on the way to recovery, but there are still some things that could be associated with it. So hope you guys like my design. It's both penguins and snowflakes. I know it's it's about to be springtime, but it was either that or white. They didn't have any other colors. My daughter had requested pink. I was gonna get pink, but they only had white, so I didn't want a white cast, so I went with this. I think I'm gonna actually end up getting another one. I have to go back in 2 weeks. They're gonna do another X-ray, because they just did an X-ray yesterday at the last week when I got the drain port taken out. When I got the drain tube taken out, they did X-rays that day. So they didn't do them again yesterday. So they're gonna do them in 2 weeks when I go back. I think they have to take the cast off. I don't know if they got to take the cast off or not for that. So, but I'll see if I can't, see if I can get another one. Maybe get the all white, let my kids decorate it. But anyway, so, it still is a little bit uncomfortable because you are so locked in there. But I don't know if this is just for me, because I still have kind of these nerve pains that are kind of here. Not quite as far as up here like the last time I said, but they're, even right now with my hand like this and my fingers kind of stretched out as far as I can, I feel like this pull kind of from here almost just all the way down. It's shooting all the way through here, and it's kind of fading off once it gets about here. So you see that this is still about as most as I can open my hand. My thumb is not very constricted. I can move the inside knuckle, not much past that. Obviously I could make a whole fist, but I mean, when I try to make a fist like this, I feel this in here. Like, there's just a lot of the trauma of the bones and everything like that. Just that movement is just not really supposed to happen yet. So, the biggest discomfort is still this nerve pain that I'm still kind of getting when I'm being told to move my fingers, and I'm moving them because I want to get this swelling down. I want to keep the mobility in them. But the more I move them, it's really putting a lot on the I think on the other tendons and muscles in the area, because my wrist is not involved at all because of how locked in it is right here. So, but you know, for the most part, it wasn't as uncomfortable to sleep as I thought. I still, I did find myself a little bit easier laying straight down as if in a bed. I still did sleep on the couch, but I feel like I was still a little bit easier straight down, and just still having it propped, because it still does. If I have it like this too long, I still do start to feel some of that light throbbing just from the swelling and stuff. So, but overall, all went well. Doctor was very pleased with how it was looking. Stitches came out no problem in all spots, and you know, they just looked everything else over and felt you know, felt good about with where it was. So when I go back in 2 weeks to get the new X-ray, they will give me, I think, the definitive about kind of how long this is going to go. Like I said, I've seen it for as short as 4 weeks and as much as 8. So with the average being around 6 or 7. So right after that 2-week mark, and they take the new X-rays, they'll look at it, and then he'll make that decision about when kind of the final, you know, the data to kind of be able to take this off and start the physical therapy. So that's really it. Nothing else really. It was pretty uneventful past that. I am happy to be out of the splint. For as odd as this feels, it does feel a lot more protected, and it feels a lot more, I don't know, it just feels like it's kind of starting on healing more, because it's just holding it so firmly in place. It's holding it so firmly in place that it's, you know, I just feel like it can't really get hurt. You know, I'm still being careful with it, but I just feel much more secure with it, than I do with the splint and the soft cast. So outside of that, you know, I'm really just going to kind of take care of the swelling and everything. The one thing I do want to say is that if you know, I don't really think it matters what your profession is, what you do. This is a significant enough injury that I think that if you're able to, and you know, financially you can make it work, you can make it happen with your job, with your finances, you're gonna need at least a month off of work for this. I think just for the fact that the little amount of sleep that you get these first couple of weeks is kind of really what set a lot of things kind of downhill for me. Was that I was just on top of pain and discomfort and nerve and all these other things kind of coming at, I just was not sleeping. So and you know, that's a whole nother, once no sleep gets involved, everything just kind of grows very, very rapidly and snowballs. So you're gonna need at least a month off of this, if not for the fact of just being able to get a week or so of no pain, better sleep, you know, before you go back. As you remember, I said in the first video that I made, I'm a crisis counselor. So with me, this is gonna be a little bit longer, just because of the nature of my job. This has to come off. This has to come off, and the pin's got to come out, and then I think actually I'm gonna get a little bit of PT in there before having to go back, and then obviously the full clearance from the doctor. So, but you know, really just depending on what it is that you do, I think that doesn't really matter in the grand scheme of that you're gonna feel kind of crappy for a little while. So I think that you know, that's just something to prepare for if you ever do have to do this. So anyway, I will I'll update in a couple weeks, just kind of after I've had this on for a little bit and kind of see what's what, see where it is. Maybe after the next X-ray, if I get a new cast, you know. But I'll throw another one up, just to kind of keep going with the progress. So again, if you need it, thanks for watching it. You know, somebody else who needs it, share it out. Just trying to be as informational as possible. You know, and just any questions that you might have, you know, leave something in the comments, and I'll you know, I can answer to the best of my knowledge just from kind of what I've experienced with this. So, all right, everybody have a good weekend. All right, later.